Good afternoon and welcome to the FEMA Region 2 Individual and Community Preparedness webinar series. My name is Allison Albright and I'm the Regional Preparedness Liaison for FEMA Region 2. I'm going to provide a few technical considerations before we begin. Today's proceedings are being recorded and captioned. The archived event will be available on the FEMA website in the coming weeks. You should hear audio through your computer speakers, so please ensure your volume is turned up so you hear the proceedings accordingly. In the top right corner, we ask if you'd like to receive news and updates from Region 2. If so, please enter your email address and we'll be sure to add you to the distribution list. We will have a question and answer session after the presentation concludes. You'll see a Q&A pod in the lower right-hand corner. Please feel free to submit your questions about the subject matter there, and time permitting, we'll do our best to answer them. Finally, the PowerPoint presentation from today will be available for you to download in the file share pod as a PDF. You can click on the file and download it using the download button. With that, I'd like to turn it over to the Region 2 Community Preparedness Officer to introduce our speakers and today's proceedings.
Thanks, Allison. Good afternoon. I'm Debbie Costa, the Community Preparedness Officer for FEMA Region 2. On behalf of our team working to strengthen preparedness across New York, New Jersey, Puerto Rico, and the Virgin Islands, I'd like to welcome you to our preparedness webinar series. The Region 2 Individual and Community Preparedness Program is focused on preparing individuals and communities for disasters by providing useful information and training, inspiring people to act and be ready for any emergency. Today you'll be hearing from representatives from 3 different paratransit agencies, Rhode Island Public Transit Authority, CENTRO, and Rhode, who will discuss how they adjusted policies and services during COVID-19 and how they will continue to operate safely going forward. Our first speaker today, Donna Fredrickson, joined MTA New York City Transit in February 2007. She serves as Deputy Director of Paratransit Outreach. The outreach team works directly with accessorized customers, advocates, community organizations, and elected officials to maintain positive conduits of information within and throughout the largest paratransit service in the country. Despite being unable to perform in-person outreach events during the pandemic, the team persevered with virtual outreaches, phone calls, and a greeting card campaign. Following Donna will be Joshua Gardner. He is the Specialized Transportation Manager and Systems Analyst at CENTRO in Syracuse, New York. Josh has worked at CENTRO for over 14 years. During high school, he started working as summer help. After joining the military, he returned to CENTRO to work in the paratransit department. He is currently the manager of the Paratransit Department and manages many of the onboard technology solutions. And finally, Chris McKenna is a Quality Assurance Manager at the Rhode Island Public Transit Authority. Chris specializes in the areas of demand response transportation, including ADA paratransit, microtransit, and flexible fixed route services. Chris is a change manager with specific focus on the intersection of system technology implementation and business process improvement. Most recently, Chris co-led RIPTA's administrative team tasked with providing COVID-19 relief services. And I'd like to hand the mic over today to Don Satano. Don is the External Affairs Division Director for FEMA Region 2, and he'll start us off by providing some remarks from FEMA's partnership with Rhode in New York City. Don?
Thank you, Deb. I appreciate the introduction, and thank you for putting on this webinar. Good afternoon, everyone. My name is Don Caetano. I'm the the FEMA Region 2 External Affairs Director. Our partnership with Rhode stems from an employee that we have who has a profound visual impairment and requires use of Rhode in order to access the building where we work. Part of the issue that we ran into is the building is in a very secure part of the World Trade Center complex. And we were having issues with pickups and drop-offs of the employee and the considerations that we have to take into place with the visual impairment. We reached out to Rhode to Donna Fredrickson, who's going to follow me and explained to her that we had an employee that was having some issues with his service, and she was very collaborative with us. We definitely walked through the issues and figured out that it needed maybe a little more supervision, and to her credit, I think Donna did everything in her power to try and mitigate the situation. That's important because the partnership that folks like Accessoride have with their customers and the customer service they provide is invaluable, because they didn't make our employee feel like he was just another person. They definitely made us feel like they listened to what we had to say and try to find a solution. And that partnership and collaboration is absolutely critical for the success of a program like that. Without further ado, I know Donna has a lot more to talk about as it relates to her program. I don't know if you want me to turn it over to Donna, Deb, or if you want to do the introduction of her again.
Nope, you can just pass the mic to Donna, please.
Yes, Donna. So please, if you can, talk about Accessoride, please.
Hi. Can everyone hear me?
Perfect.
Great. Again, my name is Donna. Thank you so much for this opportunity to talk about paratransit service. Of course, now I just lost my screen, so I'm so glad I'm still on the phone with you all. But I'm going to go with my notes here. So, of course, the MTA is the MTA, as everybody knows, the Metropolitan Transportation Authority, and New York City Transit provides Accessoride paratransit for over 160,000 registrants. We operate within the 5 boroughs of New York City. I'm sure most of you know that. That's Brooklyn, the Bronx, Manhattan, Staten Island, and Queens, and within a 3/4-mile corridor beyond fixed route. So again, the largest paratransit service in the country. We operate 24/7, 365 days a year. And pre-pandemic, we averaged upwards to about 24,000 trips each weekday. In 2019, we performed over 8 million trips throughout these 5 beautiful boroughs of ours. Our service is provided with both our Accessoride lift-equipped vans and ramped SUVs, as well as for-hire vehicles and our beautiful green and yellow taxis that everyone knows here in New York City. So I'm just going to talk really quickly and very briefly about how we kept going during this crazy pandemic, right? Can you all hear me?
Do you need us to advance
the slide? So you can advance the slide for me. I'm sorry, I lost everything.
No,
so.
We have no problem. Just let us know.
Thank you so much. So our call center is amazing. It's the lifeblood of our operation, much like everyone else who's going to speak on this call. So, of course, it operates 24/7, as we said, and we take about 25,000 calls each day, from scheduling trips to responding to customer inquiries and performing other customer service-related functions. That never stopped. When we all went into quarantine, when New York City and the country went into quarantine in March 2020, we moved everything, that 700 call center staff and paratransit administration, about 250 remote, which was amazing. And we still do it today. About 25% of our team is back in the office. But during that time, Paratransit Call Center also assisted the MTA, New York City Transit employees and social and essential workers with helping with COVID testing and hotline for over 75,000 MTA employees. We also monitored and helped New York State Department of Labor to assist with processing of unemployment calls. And also recently, we've been in the field supporting a section we call Essential Connector Program to support nightly subway shutdowns that we had and to help with the cleaning of our subway system. So it was really amazing. We just kept going. Of course, our ridership, like everybody else, declined to about 7,000 daily trips. I know when we were talking about how much trips everybody does, that's pretty amazing to begin with, but our folks needed to get to critical life-saving treatments like dialysis and chemo, and we had to be there for them, and we never stopped. Of course, involving doing everything we can to keep everybody safe, including our customers, passengers, drivers, and even our staff who was in the office slowly started to come back into the office. We followed very closely the guidelines provided to us, not only by public health officials, but our state, city, and federal levels. And that was, of course, what everybody will talk about, disinfecting our vehicles and treating them with additional antimicrobial, shields to keep those vehicles safe during their work during the day. Of course, masks and additional distance cleaning and disinfecting equipment was provided. And also, our dedicated fleet, that's our blue and white accessorized vehicles, also had extra masks on hand for those who didn't have one or their mask didn't fit properly, the passengers who traveled. I want to talk really about, too, the eligibility process. Of course, our assessment centers had to shut down, and that was amazing. We still maintained eligibility for those who needed it to get to critical appointments, as I said. So if someone who had never used Access-a-Ride needed the service because during the insanity they were diagnosed with a life-saving illness, life-changing illness, we were able to get them temporarily on the service and get them where they needed to go with the needed medical documentation. So we really prided ourselves in helping those who needed to get around the city during this time. We extended our service to those customers whose service may have expired during the COVID shutdown. We extended their service, and now we're getting them back in to get their assessments because as of November, 4 of our assessment centers opened, and we're hoping to keep expanding that to closer to normal eligibility process with appropriate safety and compliant protocols in place. So we're excited about that. Of course, we continue to provide presumptive eligibility for those emergency circumstances on a case-by-case basis. And with the review of supporting medical documents, we can get those folks on the service. I want to talk a little about service adaptations. Of course, everybody had to wear those masks, both our drivers and our customers, but there were those who could not because of their disability. Just a small group of folks, of our customers, could not wear those masks, and we accommodated them as well as others who tested positive or may have had symptoms with a special route to provide their service, and that we could pull that vehicle out immediately and disinfect it for the next person. So I'm sure that my colleagues will talk about what they did to help those who had COVID and tested positive. Other things we put in place to promote social distancing was we had a temporary curtailment of our feeder service, and we also stopped penalties for late cancellations or no-shows for our customers. We reduced the time frame between pickup and drop-off for return trips. Of course, the city in the beginning was empty, and we were flying through the city like no other time before, but we keep maintaining that great on-time performance. As I said, we provide special transportation for those who had COVID or were symptomatic or couldn't wear their mask. Up to January 2021, we suspended the fare collection. It has returned. And we also suspended shared rides. So customers weren't traveling with anybody else, just themselves and either a PCA or their guests. Of course, if they needed to travel with one additional person, we were able to accommodate that request. Our ridership, believe it or not, continues to increase. We're almost at 80% of pre-pandemic numbers. In fact, this morning we had over 21,000 trips scheduled throughout the 5 boroughs. And of course, our outreach perspective, which is near and dear to my heart, we kept up to date with our customers. A lot of work with community organizations, advocacy organizations. We also put our newsletter online on the move, and we're now producing quarterly issues and sending that out to our customers with viable email addresses. But we just keep trucking along. That's it for me. I think I went through it very fast. I do apologize if I was talking way too fast.
It was perfect, Dawn. Thank you so much.
Thank you.
I believe Josh is next up on the agenda.
Good afternoon, everyone. I'm the Paratransit Manager of CENTRO here in Syracuse, New York. We service 5 properties over 4 counties. Our annual paratransit ridership, and this is annual for us, is about a single day of MTA. So we're a tad bit smaller, but at the same time, you know, we still provide a service to our community that's necessary. So in the beginning of the pandemic, we started to reduce our fixed route service. Many of our commuter services were canceled. We canceled these services for a couple of reasons. First, a lot of people started to work from home, low ridership on those routes, but also we were starting to see some staffing issues. Many of our drivers were either on quarantine for coming into contact, or some of our more senior drivers took themselves out of work in fear of getting COVID. Each week we could have anywhere from 10 to about 25% of our driving staff not here. Secondly, we wanted to continue serving our core area. In order to serve our core area, we needed to have more buses and more drivers in our downtown service area. So what we ended up doing was we would stage buses throughout our service area to deal with overloads. And for COVID, an overload for us was about 10 to 15 people on a bus. So that's, you know, buses typically hold about 62. We have 40-foot buses. They hold about 62. So 10 to 15 was, you know, a big difference. Even though we reduced the service on our fixed route, we maintained our paratransit service. So we do service from Oswego County into Onondaga County, where Syracuse resides. We have many customers up in Oswego County that use us for dialysis. We continue to give them paratransit service, even though that service wasn't running at that time. We continued to bring them to dialysis, medical appointments, brought them shopping, wherever they needed to go to get their essentials. With the cancellation of some of these routes, we discovered we were getting calls about essential workers, nurses, aides for some of our customers were calling, and they still needed service. So because our paratransit ridership was low, and we had buses and drivers sitting around, we decided to start accommodating these people. We would pick them up and make sure they were still able to get to work and provide our community with the essential service. So with customers still traveling, drivers still out there, we wanted our customers, operators, and our entire community to feel safe. So one big thing we had to do was sanitizing. So we purchased some Curus foggers, which I'll talk about in a minute. We also continued to wipe down our buses nightly. We provided our drivers with hand sanitizer, wipes, masks, gloves, and other PPE. We also suspended fare payment like MTA did for a period of time. The reason we suspended fare payment is contact. You know, everybody that gets on the bus has to touch that one surface. We wanted to try to avoid that. And we did that also on our paratransit. So what we did on the fixed route, we kind of mirrored on the paratransit. No fare on the fixed route, no fare on the paratransit. So about 2 years, the one thing we did too is we worked with our county here, our county health department. They actually provided us with masks that we could provide to our customers on both fixed route and paratransit, which helped tremendously. We live in a low-income area. Many customers in the beginning of the pandemic couldn't find masks, couldn't get masks. We're using the same mask over and over. So we actually had masks that we could provide them. So the Curus foggers, we had one prior to the pandemic. We used it for about 2 years. It was great. It would kill bacteria, viruses, bugs, things like that on board the vehicle. Once the pandemic hit, we decided to purchase 10 additional. The Curus foggers gave our passengers, operators, and staff some peace of mind that our vehicles are being properly sanitized. The foggers are hospital grade and typically used in operating rooms. The machines spray a fine mist of a hydrogen peroxide solution into the air. It takes about an hour and a half per vehicle for it to sanitize the bus. And our goal was to have this done, the fogging of a bus, at least every other day, if not sooner. In order for us to accomplish this, we had to take our cleaning staff that typically worked overnight and make them 24/7. So as buses were coming off the road in the morning, they were wiping them down so they could go back out in the afternoon. As our paratransit vehicles came back for the operator's lunch, they would get wiped down, sanitized, so that way they could go back out. I touched on this a little earlier. We did reduce capacities on our fixed route vehicles, down to about 15 people, 25%. We also came in our paratransit department. On buses, our paratransit buses hold anywhere from 12 to 16. During COVID, we dropped that down to 4. We use cars and minivans through some of our subcontractors. So the max number of people in the vehicle would be 2 in a car and 3 in a minivan. Customers weren't allowed to sit in the front seat of the vehicles. This was for both the customer safety and the driver safety. Eventually, we went and added barriers in all of our vehicles, even on our subcontractors. And on our fixed route buses, we were doing rear door loading, with the exception of any customers that needed to use the lift, the ramp, that sort of thing. They could still enter through the front and sit in the disabled seating. The one thing we were able to do to handle the overcrowding on our fixed route vehicles, our CAD AVL system allowed us to set up an alert. So when it was nearing capacity, a bus was nearing capacity, it would notify our dispatchers. So we had drivers with vehicles in our court area waiting for overload, so that way we could cut the vehicle in, so that way we can continue to provide service without delaying our customers. So that way they could still get to work. They weren't on a packed bus. They didn't feel like they were going to get infected. They were separated. All of the peace of mind that a customer wants when they're riding public transit. So in all of our vehicles, we had plastic barriers installed around the driver. This may seem like an easy task, but it was quite difficult. First, it was getting the plastic shields. Everyone at one time was basically trying to buy the plastic shields. So we had to kind of design our own. Some of our bus manufacturers have actually helped us, volunteered their time with their engineers to help us come up with a design that would work for our drivers, customers, and still be safe. It wasn't blocking the driver's view, no reflection of light, that sort of thing. So that way it was continued to be safe for passengers and drivers. Our vendors on our paratransit side did the same thing. They put barriers behind the driver on cars and minivans. That way everyone felt safe. So throughout the pandemic, early on, we started getting customers calling us. They needed to go get COVID tested. So in the beginning, there's this big fear. Everyone's like, oh, COVID, we're not sure how it spread, that sort of thing. But we took the stance of our customers still need to get, to these testing sites. They need to know. Many of them needed to get tested before they could go to their doctor's office for a required surgery, that sort of thing. So we came up with a plan. Our plan was when the customer called us and let us know that, hey, I need to go to a testing facility, we would schedule them on a vehicle where they were the only customer. That driver was notified ahead of time. We would then take that customer to the testing facility. The driver would wait there for the customer. When the customer was done getting their test, they would get back on board the vehicle. The driver would take them back home. The driver would then bring that bus back to the station. Or if it was one of our vendors, they'd bring it back to their garage, and we would clean that bus thoroughly. Many of the times we use that cure as fogger. As soon as the bus got back, we put that fogger on there, let the fogger go for the hour and a half that it takes, you know, kill anything that was possibly on board that vehicle. You know, after that, the fogger happened, we would put our cleaning crew on there, and they would wipe down all the surfaces on board that vehicle as well. So like Donna did, we also extended eligibility for our customers. So anybody that was due to expire, we went into the system, changed their date. That way they can continue to ride. We would reach out to them over the phone, contact them and say, you know, we've moved your eligibility process, or eligibility recertification date to a later date. We weren't sure how long it was going to be, so at first what we did was, instead of bumping it a month, we just bumped it out an entire year. So that way, we didn't have to worry about every so often going in and changing it. It gave the customer a little bit of peace of mind that this is not something they have to worry about right now. We did also maintain our eligibility process. Our process is a little different than MTA's. We have a paper process, so we would still receive applications. We would go ahead and process those applications. Some customers would contact us and say, unfortunately, I can't get in to see my doctor right now, to have them fill out the paperwork. If they were a new customer, we would talk to them about their, you know, what is it that you need, what's your mobility, work with them and put them on the service until we could get a completed application on them. We do conditional eligibility here, but due to the dip in ridership, we were down to like only 30% ridership at one point. Luckily right now we're getting back up there. We're about 70% of what our ridership was prior to COVID. But due to this dip in ridership, any customer who was conditional and sometimes could take the fixed route, we would just provide them the ride on our paratransit service. And one thing I wanted to touch on quickly too is, with our paratransit, even though we had those capacity restraints, our ultimate goal was to give all of our customers a trip all by themselves. And about 95% of our rides were that way. There was a few rideshare that happened throughout the pandemic. The rideshare tended to be people going to work together. So they're going to work. Some of them actually lived in the same building and would go to the same work site. So those customers at times would be put on the same vehicle. Hey, Allison, I'm getting a blank slide.
So we see your slide. I'm not sure why you don't see it, but it's about vaccine shuttles and scheduled shuttles to bring people. So if you could continue talking, we can advance the slide if need be.
Okay. I believe that's my last slide. So yeah. So at the beginning of the year, we started to do vaccine shuttles. The state reached out to us. They were creating some vaccine centers in our area. One was in Utica, New York. One was here in Syracuse, New York, and wanted us to provide transportation. The one in Utica, we just do a parking lot shuttle. It's out at a college, and we provide shuttles from the parking lot to the door because it's a rather long distance for people to walk. Here in Syracuse, we actually run a shuttle from our hub location to the state fairgrounds where the vaccine site is. We run that every half an hour. It goes back and forth to the fair. That way our customers can still continue to get to the vaccine center. On our paratransit side, we did the same thing. We had shuttles that were happening. We were taking people to vaccine centers. A lot of times they didn't know when the appointments were going to be. They'd get the appointment. It would be outside the normal hours that we traveled in their area. but we just continued to allow them to ride. We provided those trips. We didn't want us to be the reason they didn't get to their appointments. And lastly, I'll note, we worked with our county here, and we're picking up at senior centers, taking people to the vaccine centers. That way everyone can make sure they get the vaccine if they want it. And that's it for me.
Thank you so much. And just to remind everyone that type your questions in, and we will circle back once the final presenter is done. Chris, you're up.
Hello. Sorry about that. I was having a hard time coming off mute. Can you hear me now?
Loud and clear.
Okay, perfect. Thanks very much. Thank you for the presenters so far, and thank you for everyone who's viewing. I don't see the slides. Is it similar to what was happening with Josh? The slides are there, but I'm just not seeing them.
That would be my guess. We see them.
My apologies. I saw it flash there for one moment. So just a quick overview. Rhode Island Public Transit is one of only 4 statewide transit authorities, but with that being the case, we're actually quite small in comparison to some major cities. This is one of our newer vehicles that we're seeing here. So when COVID hit, we had a significantly reduced demand. We operate 3 different services: ADA Paratransit, a human service contract through a group called BHCDH, Behavioral Health Developmentally Disabled in Hospitals. And we also operate flexible fixed route services. And we went from cruising at approximately 25,000 trips per month to a low of 4,000 trips in April. It was quite concerning because we still had a responsibility to employ drivers and a responsibility to provide transit to Rhode Island, but that demand had gone down so significantly that we initially weren't sure how we were going to maintain our drivers' gainful employment. We determined there was essentially 2 ways to look at this pandemic. One way was from a business perspective, and another way was from the human perspective. And in general, transit agencies, they put on 2 hats and interchange them depending. One hat is that we're operating at a business. Another hat is that we're operating as a social service. And so we had said up front, which one are we operating here? Are we coming from a social service perspective here, or are we coming from a business perspective? You're always coming from both, but one is leading at different times. In this perspective, we led with social service. So the first thing that we did was that we reached out to Rhode Islanders in an attempt to also employ our operators to give them hours. We reached out to Rhode Island community groups to see if anyone needed help. And one of the first community groups that reached out said that they did indeed need help because their volunteer network of delivery individuals had fallen back considerably, whereas people still needed to eat, was Meals on Wheels of Rhode Island. So this is just an article from Mass Transit Magazine from, I want to say, April of last year. So right when we hit that 4,000 low, we reached out to Meals on Wheels, and they said, yes, we need your help. So we employed our drivers to deliver meals and to essentially bolster that decimated Meals on Wheels volunteer network. It worked out quite well for us and for the people of Rhode Island and for Meals on Wheels. So it was a really good example of a community initiative. We've performed 10,000 trips. And essentially just on the slide here, it just states what we did. Here's one of our drivers actually delivering one of the meals on our vehicles right now. So moving on, we said we need to do more, so we wanted to expand outreach. So we reached out to the Rhode Island Office of Healthy Aging, and there was a group there, Fidelity Investments, I'm sure we've all heard of. Well, they run a division called Fidelity Cares, and so they had no one on their campus anymore. They have a large campus in Smithfield, Rhode Island, and everyone had been gone to work remote, all of their employees, but they still had a kitchen because their campus operates a cafeteria, and so they still had a kitchen, and their kitchen workers still needed work. And so they essentially said to the kitchen workers, make 500 meals a day, as you normally would, and we'll make sure that those meals go to needy people in Rhode Island, even if you can't serve the Fidelity Investments employees anymore on campus, we'll make sure that we get those meals. So they partnered with Healthy Aging Rhode Island and to get those meals to senior centers and to individual homes for individuals that were no longer able to go to the senior center. And so their concern was transportation, and we were happy to jump in. So I actually think that the number's not there, but we've delivered 30,000 meals in partnership with Fidelity Cares, Healthy Aging, and the Rhode program. And so that was a really big win for us and really great for the state. So again, we focused on social service and community initiatives as much as possible. In terms of filling service gaps, there was a shuttle service called Little Rhode. It was an autonomous vehicle shuttle, and it went in a pretty important corridor downtown through state offices and into a couple of dense neighborhoods. And it actually pulled off the road quite quickly, which seems unusual because it's an autonomous vehicle, so therefore it doesn't necessarily need a driver. So actually, autonomous vehicle might be the best model during a COVID environment, the least human exposure. But actually, there was an entire team of people that supported the autonomous vehicle, and that entire team had to step back, and the autonomous vehicle came off the road. So, so that we made sure that people still got transported, we replaced that autonomous vehicle shuttle. In terms of community initiatives and supporting local efforts, Honeywell is a major producer of N95 masks, and there was a shortage of N95 masks nationally. So Honeywell went on a massive hiring spree in order to create more N95 masks. And we said that we would get anyone that we could to that Honeywell facility. So they essentially were hired at Honeywell and then were given the option to call us and either go on our fixed route service or our paratransit service. And I believe we've transported over 17,000 individuals to that N95 facility. So again, another really important community initiative. And we also worked with Employ Rhode Island, so the Rhode Island hiring group, and so we're proud of this. Staying safe, so a couple of the other presenters, Donna and Josh had spoken to this. So in terms of actual business initiatives, we did some similar things to the others. We cleaned our buses every 4 hours while they were in operation. We went down to 15 passengers on the fixed route service. We went down to no more than 4 passengers on the paratransit service. We didn't ask people about their state of being or their wellness or where they were transporting to. Our belief was that the fixed route was still operational, and if a person got on the fixed route bus and they got off at a testing site, that was essentially their own business. We may have been able to infer that they were going to a testing site, the same way you can infer what the major business is at the end of a bus stop. But we didn't ask those questions. We believe that public transit is public and that your information is essentially private in that regard. So we didn't ask anyone what conditions they were dealing with medically, be it COVID or anything else. We just asked them to maintain social distancing, wear a mask, and to call us for an alternative option if they felt that they were unwell and they wanted to divulge that information. But otherwise, we didn't ask any prying questions. So let me keep moving forward. Oh, I should also speak that yes, we also used foggers too on the vehicles. We actually employed many of our drivers. We actually employed many of our drivers if they wanted to go into bus cleaning so that they wouldn't be as customer facing. They were welcome to go into bus cleaning. And actually, our downtown central transit hub, Kennedy Plaza, has always maintained a bus stop for the Paratransit Division, but we rarely use it because we're demand response. So it's not often that someone would specifically say, come to the bus stop on Kennedy Plaza when they could get picked up in the business location or any other place downtown. But the buses in now Kennedy Plaza are being cleaned frequently at Kennedy Plaza, and so we gave our bus operators the option to pull into Kennedy Plaza and to be cleaned the same way if they were unavailable to come back to the base. So we just recently implemented something that we call Vaccine Trip or V-Trip. This was in partnership with the governor, the Federal Transit Administration, and our CEO, Scott Aberdezian, who I have to give credit to for a number of these community initiatives. So Scott Aberdezian was the longest-running mayor in Rhode Island history before he became our CEO, and he ran the second largest city in Rhode Island, Warwick. And in his time as mayor, his many years as mayor, he's known for his community initiatives, and he's known for essentially assisting members of the public. And so he's brought that with him to RIPTA, and we're very fortunate to have him. So, but he coordinated with Governor Dan McKee and coordinated with us, and so we're offering a no-cost trip to vaccine sites all around Rhode Island, both on fixed route and paratransit. The other ongoing initiatives, we also partnered with DCYF, so the Department of Children, Youth, and Families. Over at Sembrano Hospital, they have a residential ward, and that was for women, children that were essentially in shelters. And if they had gotten COVID, they couldn't remain in the shelter, so they needed an alternative place where they could stay. Obviously, the shelters are group shelters and quite close together. So the Department of Children, Youth, and Families had taken Sembrano Hospital, who had a large ward of residences, so people could stay at the hospital in a chalet, essentially, if they were unwell and they needed long-term care. And those chalets were made available to individuals who were COVID positive. We would make those transports. There's also, we also did some work with REMA, so the Rhode Island Emergency Medical Association. These are called ACI transports. And so these are for homeless gentlemen who were otherwise in homeless shelters who had caught COVID. And they retrofitted what had one time been an old prison to give them essentially a bed, a warm meal, and a place to be while they were getting better from COVID. That's for the persons that didn't need to go to the hospital, and it also stopped COVID from being spread among the homeless community. So another initiative that we had was that we began to operate, especially after ridership increased, we began to operate paratransit buses along high-density corridors. So if a bus driver would pull up to a location and he knew that there would be 20 persons, rather than leave 5 behind, there would be a paratransit bus coming directly behind him. And so that was another initiative that we had operated in Rhode Island. So as for today, Honeywell is ongoing. Our work with Meals on Wheels is ongoing. And these are things that we hope that we can integrate long-term into what we do if we're at all able to do so. So essentially that was it for me. I think I'm leaving a couple of minutes extra here. I could continue to talk, or we could open the panel up to discussion, questions and answers. Which one's best?
If there's something else that you want to say, by all means, say it. We only have about a half a dozen questions or so that we need to address.
Sure. So I guess the only thing that we'd really like to say on it is that, I suppose one thing that I should discuss that the other presenters had discussed was the eligibility process. We had suspended, not suspended the eligibility process, but we had suspended renewals. So anyone who was currently in the system would remain in the system ongoing. So that's an important thing to speak to operationally. Beyond that, I think I've covered most of the bases.
All right, I think all of our speakers did a tremendous job in being very creative in solution, problem solving. I think you all get an A+ for sure. But we do have a few speakers, a few questions for the speakers. And the first one, Donna, is for you. Someone had asked if you could speak a little bit more about how you routed the COVID positive or non-mask wearing customers. Were the operators aware of who they were transporting?
Yes, I'm so sorry. I started to answer the question. I finally got back my screen here, so I started answering the questions beforehand. So that's a great question. So we did ask, and we still are asking during the reservation process if the individual has tested positive or is showing symptoms for COVID. And we have a special route that's provided by our broker service. Broker service, like I may have not been clear, but broker service is the for-hire, what we call our for-hire vehicles and our yellow and green cabs. So we have an independent company providing a service for those who have tested positive that allows for cleaning in between trips. And in regards to those wearing, that are unable to wear masks, this was such an interesting, not interesting in the sense for me who provides and helps people navigate our system, but a lot of times the complaint would kind of originated during the day of service. And the driver would arrive, the person wasn't able to wear the mask, everybody kind of freaked. And then, of course, they called us here at Transit, and we were able to reroute a what we call a COVID route, or the route that I was talking about before, to the location to provide the service And then they would reach out to customer relations, our team, and we would work with the individual to make sure we had the proper documentations on records to allow for reasonable accommodation. And then from then on, the customer would have that information in their file, and we wouldn't have to embarrass them during the service. We would just know to schedule them on that route because the individual couldn't wear a mask for whatever reason that was. And it's only a small group of people, but you really got to know. There were a lot of parents with children who are on the spectrum, and you know, just providing that one-on-one support for them during such a trying time, I just felt was really rewarding for me. So that's me getting emotional. Sorry. Does that help?
It does. Thank you. The next question is actually for each of our speakers today. If you could each let us know whether or not there were any issues with your labor unions during the crisis. If you want to start us off there, Donna.
Gosh, I am not the person to address
Okay.
that. I'm so sorry.
No, I'd rather you speak to what you know. Chris and Josh, could either one of you speak to that?
This is Josh. I can speak to that. One of the things we did early on was bring our union to the table weekly. So we would have weekly meetings with them, Zoom calls, things like that, but we would meet with them weekly to try to address any concerns that they have. In the very beginning, it was mostly, you know, masks. They didn't really push back too much. I mean, they worked great with us. The drivers were excellent. Providing customers masks, they understood, like with some of our customers couldn't wear masks either. They understood that. That's kind of why we went to the barriers to have something else there if a customer couldn't wear a mask. So, I mean, overall for us, the union worked with us hand in hand, and we came up with solutions together.
Thank you.
I can speak a little bit to it too. It's in the same vein that Josh is discussing. So I wouldn't say we had issues with the union, but we definitely had the union considerations that were taken into account. And so some of the things that we had done from that perspective were that we gave operators, the major consideration was how do we keep operators employed when we don't have route demand. And so that's why we operated initiatives such as Meals on Wheels, the Fidelity Cares initiative through Elderly Affairs. These things were important to make sure that we were still employing people. People still had bills and things of that nature. So, sorry, just give me a moment. So that was one of our major considerations with the union. And then the other option was for persons, operators who felt that they were immune compromised and were concerned driving a bus during the COVID environment. They were given the option to transition to another area of the business, such as bus cleaning, where they wouldn't come into contact with the general public, so that way they could limit their number of contacts but still remain gainfully employed. So these were some of the major concerns that we had through the union. Beyond that, our union was fantastic. Our union president has, published some information to the union board, essentially saying that what we do every day is move people around. We don't ask, any details about their health, et cetera, et cetera. We're selfless in terms of the bus drivers are selfless in terms of what they do, and all we're asking for you to do is maintain essentially that level of selflessness, and that's essentially what they did. So we're very thankful to our union president and to our union employees.
Thanks, Chris. This next question I would say should go to each of you as well, or whoever would like to speak on it. Can you each talk about any changes with the way you had to handle visitors from out of state during the lockdown?
I could speak to it just briefly.
Sure.
So the interesting thing about Rhode Island is that the population never goes up or down. So every time someone's born, someone passes away here, and every time someone leaves, someone comes in, but that doesn't happen very often. So Rhode Island's known as being very colloquial and very small. So at the whole of it, we generally only have between 25 people coming in that want temporary ADA eligibility. So to that question, I don't believe that we had a single, I could go back and look, but I don't believe that we had a single transport in-state from an out-of-state client during the COVID process.
Okay. How about you, Josh?
So just like Chris, we didn't have many, I think we had one visitor, but it was in-state. I think New York State had the 2-week quarantine there for a while when you came from another state. So I think that kind of limited how many people were actually coming to New York State. So we had very few. We just had the one, inside New York. And so we just handled it like we normally would, giving them visitor status when they got here. I believe they arrived by a bus. We picked them up from the bus station, took them to the hotel, that sort of thing. So we just handled it as the norm.
Okay. And then, Don, I saved you for last because I would think that you're the most likely one to have had folks from out of state. Did you have that experience?
That is a question I find very interesting because we do have, we do establish visitor status, 21-day visitor status for those visiting our city who have a reciprocal service, who already have established paratransit service where they live. I would have to go back to our eligibility unit to see if we had any request during that time frame and what we did, but we did not, you have to follow strict guidelines here in New York City in regards to travel outside. Of course, those are being lifted now. So I would have to get back to everyone. I don't know what we did in regards to those asking for service during this time. I don't think we would limit them, of course not. But that is an interesting question. Thank you.
Okay. All right. Well, this is the last question for discussion. If we could, if each of you could respond, if you have an answer, of course. But can each of you talk just a little bit about how the restrictions on the ride sharing impacted your budget or operating costs, and how have your efforts, have any of your efforts to be reimbursed, and any lessons learned that you would like to share with our audience? Donna, do you want to start?
I'm sorry. Did she think? That is another area I am not. I try to stay well out of that. We maintain.
Okay.
Yeah, sorry, but I know we maintain service, and the fact that we returned with fare collection in January was met with some grunting, but that was the same with MTA. They returned back in December to the collection of fares, but as far as budget goes, I'm so sorry. I'm the customer person. I'm sorry.
Okay. All right. Josh, can you speak to that?
Yeah, so here at CENTRO, we have some subcontractors. And the way our contracts are kind of built with our subcontractors is some of the work is what we call as needed. So we only use them on a day if we need them, because it does fluctuate from day to day. So we did have some savings. Some of our vendors did decide that they were just going to close down. And so when they made that decision, it actually saved us a little bit of money because we were obligated to continue the contract with them, but they chose themselves to close their business down for a period of time during COVID. A decision that they made, which we were okay with, and then they ended up starting back up for us probably, I think it was like September, October. So there was some savings that we did have there because we were anticipating, we were going to use that service. We didn't, so there was a little bit of savings that we did see.
Great. How about you, Chris?
So I can speak to the RIPTA experience a little bit based on this. So essentially, we determined that whatever was needed, we were going to do, and we'd worry about the money later. So there were some services that we offered that we believed that we had a funding structure, and essentially it all happened so fast. So we would check in with the party, we would check in with the FDA, and so we believe, okay, yes, I believe that there is a funding structure for that. I'll have to get back, and sometimes that would be 2 weeks or 3 weeks, or it would be a new service to paratransit or a new service to public transit that they were unaware of. So what we said is we're going to provide the service, and we'll worry about getting paid later. The same way when you go to the hospital because you don't feel well, you don't ask the nurse every time she does something, how much did that cost? You work on getting better. And so we worked on getting the state better and on getting people better, and we worried about the price of each Band-Aid after the fact. Now, I know that this has given our budget director some fits afterwards because there were some things that we had promised, for instance, the transport to Honeywell, that we had essentially a tacit agreement would be refunded and then realized afterwards that actually they won't be. Fortunately, the CARES Act has been very forgiving and has allowed agencies the ability to find funding sources for some of these things that the FTA knows that we did in order to help the community during the time that may not have been traditionally fundable. So to answer the question, some things we did were directly funded. Some things we've never been in a COVID environment before. Some things were done ad hoc with a tacit agreement. In some cases, that agreement was met. In other cases, after further evaluation, they were unable to meet it. But fortunately, with the CARES Act, there has been funding structure that has allowed us to remain whole and to apply resources where they were needed to be applied. So.
Well, thank you so much. All I could think of was if I was in the hospital and I asked how much an aspirin cost, I probably wouldn't take the aspirin. But kudos to you and to Ripta. You know, you're an amazing group of individuals. We truly appreciate the services that you provide to our various populations. I know we mostly talked about people with various disabilities, but I mean just older Americans. And I know, you know, my grandmother was over 100 years old, and you can't beat Accessoride in New York, that's for sure. So kudos to you all. Thank you very much to our panelists for taking the time to talk to us today, and for all our participants for joining us. I did put a very short 3-question poll up on the screen. If you'll let us know what you thought about today, if we should be doing similar topics in the future, what would the interest be? The slides are available for download in the pod between captioning and the poll. You know, just click on it and then click download. And we do have a number of webinars coming up. I think we still have 4 or 5 for April. Tomorrow is Earth Day. We will be talking about community gardening. We will be addressing vaccine concerns next week, and child abuse in New Jersey. Great series for mitigation, wildfire prevention, dam safety, and of course all of our webinars can be found at the first link on your screen. Today's webinar was recorded, along with all our previous webinars can be found at the second link. And if you don't already get news from Region 2, click subscribe, and we'll be happy to add you to our preparedness and resilience mailings, which go out typically every 2 weeks for the bulletin and every week for the webinar announcements. With that, it's 12:59. We couldn't have timed this more perfectly. I wish everyone